Welcome to Module 1 training of the Medical Emergency Response Team for Pasadena Independent School District. The Medical Emergency Response Team is the replacement for the ER team, the Emergency Response Team. The M, medical, has been added as we recognize when a person responds, you may not be responding to a cardiac event. It may be diabetes, asthma, or a mass casualty incident. Warning: this training contains explicit images of actual traumatic injuries. Viewer discretion is advised. In real life, when responding to an emergency, you may be exposed to blood, bodily fluid, visible breaks in the skin with bones protruding, or other upsetting material. If you are easily upset or the sight of blood bothers you, you may not be a good candidate for this team. Please ask to be removed from the MERT and do not participate in this training. Again, if the sight of blood and body fluids upsets you, this is not the place for you. The purpose of the Medical Emergency Response Team is to provide guidelines for emergency medical care of all students, staff, and visitors, whether it's a small incident or a mass casualty episode. The Medical Emergency Response Team will be trained by the school nurse to work together during a mass casualty incident or to respond appropriately on a smaller scale. Things like chest pain, shortness of breath, or injuries may require more than one responder. CPR AED responders should have taken basic adult, pediatric, and infant CPR and AED. This would be any responder who has volunteered to work in the red triage zone. First aid, tourniquet use, and standard precautions are recommended for all team members, although they're not a requirement. The more training, the better the response. As you can see by the map, there have been 95 school shootings since the Connecticut massacre. We know that there are weather events. Hurricane Harvey, Tropical Storm Harvey, I should say, hit our region pretty hard. 1 in 3 students in the United States of America lives within 3 miles of a potential chemical exposures. 1 in 3. Considering our proximity to 225 and all of the refineries, we probably help tilt that statistic. The risk of fire, mass shooting, or any type of casualty from any cause is why we prepare. We need this training so that in the event that there's an incident on our grounds, we are prepared to respond and save the most lives. So where do we start? The first place to start is with defining all of the responsibilities. Just by attending this training, you have shown an interest in wanting to help. Medical Emergency Response Team members will respond to designated locations to perform a designated responsibility during an MCI, mass casualty incident, or any other emergency on campus. Mass casualty incident is a term used to identify a situation in which there are more victims than resources. Most campuses have one registered nurse. If there are 4 or 5 victims, one nurse may not be able to adequately help all of those victims. On a smaller scale, there may be a time when in the school clinic the nurse is dealing with an asthma attack, another student is having a seizure, and a staff member begins having chest pain. 3 victims that all need the nurse, one nurse. This is why we need medical emergency response team members, so they can support the nurse to ensure a positive outcome for all of the victims. Each member will use the knowledge and skills they gain during their training to administer medical care. The expectation is that all responders will follow standard precautions and follow blood-borne pathogen procedures. Standard precautions, universal precautions, or blood-borne pathogen procedures all refer to the same thing. All of them mean, if it's wet, warm, and not yours, wear gloves. Anytime there's a risk of exposure to blood or body fluid, you or the victim are at potential for risk. Wearing gloves reduces that risk. Washing hands reduces that risk. Your nurse will teach you the appropriate way to put on and take off your gloves to decrease the risk of self-contamination. Each member should stay within their training or scope of practice when rendering aid. It's also imperative that each member on the team can identify and articulate if additional assistance is needed and then summon that assistance. This process map outlines the role for each staff member on the medical emergency response team. It's easy to follow, color-coded. The nurse should fill this out at the beginning of the year and ensure each medical emergency response team member has a copy. It's a good idea to keep a copy with each AED as well. If each team member knows what the other is responsible for, it will help in the event anyone panics. Everyone plays a role. If you have not been assigned a role yet or volunteered for a role, now's the time to determine that. When you looked at the process map, you saw orange squares. Orange squares indicated a medical emergency response team member. The home plate, pink, stands for anyone who works in the front office and can lend a hand. The principal is the purple triangle, also known as the incident commander until EMS or other law enforcement arrives and takes control of the scene. The nurse is blue. She's the square. Backup people should be assigned for every single role as far as triage goes. The smiley face indicates an additional responder. It may be a runner who's running supplies or flagging down an ambulance. Red triage zone indicates a staff member who has the skills requisite to work in the red zone. Yellow, the yellow zone. Green, green, and black in the black zone. So let's talk about each role individually. The front office staff, pink home plate. That might be your secretary, your bookkeeper, your registrar, your attendance clerk. These are the folks that are probably going to get that first call that we need help, whether it's a student running into the front office yelling the nurse needs help, or it's a phone call from a classroom. If they are the first person to hear of the incident, they will activate the campus medical emergency response team. Some campuses have a code phrase, Team Teddy Bear to the cafeteria. Others will say, MERT, go to the front office or wherever the incident is. They're also usually the ones tasked with calling 911. The principal will ask one of them to make that phone call. The principal, the purple triangle. The principal is the acting site commander. They will communicate with district administrators. They will monitor the situation. They will follow the outlined district policies and protocols in the red book. We have this massive safety book that has plans and contingency plans for almost every insult you can imagine. They will also assign flaggers for ambulance arrival. They'll assign someone for crowd control. They will generally oversee the entire incident until relieved by law enforcement. Before anyone responds, we have to check the scene for safety. Regardless of your role, whether you're red, yellow, green, black, extra personnel, front office, you will still follow the incident commander, your principal, or the administrator in charge at that time, command. If the command is to evacuate, you will evacuate. If the command is to lock down, you will lock down. You do not begin your role responsibilities until the all clear is given. Dead responders can't save anyone. Your personal safety should always be the first thing on your mind. You should only respond once the all clear is given if you are emotionally, physically able, and you've had the appropriate training. If you are working in the red zone and haven't made it to a first aid or CPR class, you should not be responding. So let's talk about each roles and the individual responsibilities associated with the colored categories. The nurse is blue. The nurse's number one job in this scenario is triage in less than 45 seconds or less, ideally 30 seconds. The nurse should look at every victim and decide upon the immediacy of the need for care. There are colors, red, green, yellow, and black, that the nurse will tag each victim. Red means you need an ambulance right now. Yellow, you can wait a couple hours. Green, you could wait a day. Black, you are not expected to survive. In this situation, if there are more victims than responder and the nurse needs to tag a victim, the nurse will not be rendering aid. The nurse's sole role in a mass casualty is to quickly identify the need and staging of each victim. The goal is to do the most good for the most victims. That can only be achieved by efficaciously using resources appropriately. The nurse will utilize the Start Jump Start Triage algorithm. This is an algorithm that has been in use for over 30 years. It quickly, systematically, and objectively leads the nurse to the correct color placement for staging for ambulance departure. The first question is, are they able to walk? Yes or no. If they can walk, they can wait. For some folks, that might sound harsh, but it is reality that we have to look at who needs an ambulance right now. Someone suffering a heart attack needs to be seen before someone with a broken arm. If they can walk, they'll go to green and be tagged green. But if they can't walk and the nurse comes upon them, then the first thing she'll check is, are they breathing? If they're breathing, she'll go on to look at their respiratory rate, their heart, their mental status, and her decisions will be based on what she finds. If they're not breathing, she'll reposition their airway. If they're an adult and after a head tilt, chin lift, they remain apneic or not breathing, then the nurse will tag them black. There will not be CPR performed by the nurse. There will not be rescue breathing performed by the nurse. In this role, the nurse's job is to quickly identify who gets the ambulances and when. Those who have been charged with working in the red, yellow, or black team can begin CPR and can render aid, but that is not the nurse's role if there are more victims than she can handle. If there's only one victim, then clearly the nurse would initiate CPR. All of the colors have a meaning, and this is universal regardless of which algorithm the response team is using. Start and Jump Start are only one of many. However, the colors, red for immediate, yellow for delayed, green for minor, and black for expectant, are universal and used across the world. If someone is tagged red, the associated meaning is that they need to be in a hospital within 2 hours or their chance of survival will decrease greatly. Those with a yellow tag can wait for care, usually a couple of hours. These victims still need hospital care. If they were to go to the emergency room with a bone sticking out of their arm, they would get immediate care. However, someone needing CPR needs care before them, which is why they were tagged yellow, and that person who's gasping for breath was tagged red. Green tags, walking wounded or worried well, you may hear them called, they may or may not need medical care at all. After all critical injuries and then the stable injuries are treated, then those tagged green will receive treatment. Those tagged black are either deceased or expectant, meaning their injuries are so severe that unless or with heroic measures, they will not be saved. Remember, the goal of triage is to do the most good for the most victim. So we assign resources based on who will benefit the most from their use. Setting up the triage zones. Each zone is indicated by a color. If we separate out our zones into red, yellow, green, and black, it'll make for a faster, more efficient system. We need to consider before an incident where these triage zones will occur. After this presentation, when you meet with your team on your first training, you need to talk about where will our zones be. Some people might utilize their gym if it's large and section it off into 4 zones, red, green, yellow, black. Other folks might use classrooms, 4 classrooms in a row. But what's your plan B? What if your building's underwater? Or what if you've had to evacuate your building? Do you have tennis courts? Do you have grass? Is there anywhere you could go to set up your zones? You also need to consider, where will the ambulance come in and leave with ease? You don't want EMS going all the way across your campus, so getting near an entrance or exit is also something to consider. When you think about inside or outside, it's important to have multiple plans. A plan A, a plan B, and maybe even a plan C. Your zone might be inside or it might be outside. On this slide, you see multiple zones set up outside. If you look at the top left, Broward Sheriff High School shooting in Parkland, Florida, just above the two fire trucks parked side by side, you see the red zone where they laid out large red tarps. This is an example of how to set your zone. The picture on the bottom, they've got red, green, yellow. This was a multi-vehicle incident where a truck caught fire and there was an explosion. They expected multiple victims as there was a bus involved. On the right, again, you see red and yellow. They didn't even set up a green because the walking wounded worried, well, we're probably cordoned off in another zone. So think about, where will we be? How will EMS arrive? How will EMS depart? And proximity. If I can keep my victims closer, it's much easier for us to work as a team versus spread out across the large campus. When you make your zone, there's no need to spend $1 million on brightly colored tarps. These are examples of dollar store tablecloths. They're plastic. You can throw them on the ground, throw bricks or shoes on them to hold them in place, and voila, you have some zones. Other nurses have made flags where they can hang things. It doesn't matter what you use as long as you have some system in place for marking the zone. If someone comes across a red victim who is now moving, they want to be able to get them to the right zone. Everyone should know where each zone is located. Each colored triage responder should have a bag of supplies. Most schools have a large bag with individual bags inside. I've been inside Dobie, Parks, Memorial. Most of the nurses have something similar to what you're seeing on this slide. On this slide, this is from an elementary campus. The nurses even marked delayed, immediate, and minor on the coordinated vest. That person would go and give care to the people with the associated tag. In the bags on this particular campus is the tablecloth to set the zone, a flag that's been made that could be posted high for people to see, the vest to wear so that you're identified as a responder, gloves, lots of gloves, you can't have too many. There's a folder, and inside the folder is the triage tracking log, and you'll see that in a few slides. And then a notebook for taking notes or writing important things that the nurse, responder, or anyone may need later on during this emergency. This is what the tracking sheet looks like. On the left-hand column are spaces for names. If the victim gives you their name, write exactly what they tell you. Circle their gender. If they can tell you their age, write that in. And if they've already been tagged by the nurse, you want to indicate the color tag: minor, delayed, immediate, or deceased. If they're getting in an ambulance, ask the EMS driver, where are you taking them? This will help in reunification. LBJ, Bentov, Memorial, Baytown, wherever they're going, we need to write that down. If they're unable or unwilling to give you their name, consider the victim who's unconscious, like the inset picture on this slide. Then we want to write as much identifying information as possible. Middle-aged woman, light brown hair, light blue hoodie, gray pants, black sweat, black shoes, approximately 5'2" to 5'4". Write as much information, Caucasian, as much as you can, so that later, when the family's looking for this person, you can say, oh, there was someone matching that description, and according to my notes, they were transferred via EMS to LBJ. So get as much information as you can. With our younger friends, I know it's far more difficult. What is your name? Bubba. Okay, well then write Bubba. Write as much information as you can. What was Bubba wearing? What color pants? What color shoes? What color hair? As much as you can. Let's just go back and make sure we're all still on the same page. The triage sequence. The very first thing is scene safety. Dead rescuers save no one. Whatever your incident commander, your administrator, says is what you do. If lockdown is the overhead call, then you lock down. If evacuate, you evacuate. Shelter in place, you shelter in place. Whatever command is given to the entire staff is the command that you follow. Once you get the all clear that it is free to move about the cabin, now you may begin and assume your role. The nurse will have a systematic, organized route that she takes when triaging. Perhaps she's going to go just straight up and down in rows, or she's going to go left to right. The goal is for the nurse to not miss any victim and spend less than 45 seconds per victim. It's fast. The goal for the nurse is to put her hands on every single victim present. After she completes her first round, she'll go back and do a second round. If you are working as a red team member, you will begin treatment on those tagged with red. Treatment may be anything from CPR to splinting to direct pressure or putting a tourniquet on someone if care is going to be delayed. You will follow along behind the nurse and you will treat victims as you come upon them. Stay systematic. Don't jump ahead. It'll be difficult. People will be yelling your name and asking for your help, but you must go in the order that you find the victims to ensure no one is missed. Those working in the green zone will start immediately clearing the scene. An average campus in our district has about 700 kids plus 80 to 150 staff. The nurse doesn't have time to triage that many people. If you are tasked with being on the green team, you will immediately start yelling, "If you can hear my voice, please get up and walk towards me." The nurse should only be triaging those victims that are unable to get up and walk off scene. Even if there's broken bones, bloody noses, head lacerations, cuts to the face, those will bleed terrible. But if somebody is awake, alert, walking, complaining, crying, that tells you that they are intact. Their brain is working, they're breathing, their neurological system is intact, telling them put one foot in front of the other and keep walking. So the green folks are going to start clearing the masses. If you can hear my voice, walk toward me. They should have a minor first aid kit. If you're working in green, at a bare bone minimum, you want some Band-Aids, some gloves, maybe a bottle of water. Don't forget to use hand gestures. Some folks have a hearing impairment. Others may have lost hearing during the incident. If there's a loud noise, an explosion, a shotgun, or panic, sometimes people won't process what is being said. So it's important to use hand gestures, put both hands up, and wave towards yourself while saying, "Come to me." We want people to see and hear us. If there's 4 people working in green, all 4 people should be standing saying, "If you can hear my voice, come to me." And keep yelling. If it's smoky, cloudy, they may not see you, so keep yelling so that they can find you. As people come into your zone, you need to document their name. Who's here? Why are they here? Write as much comments as you can. If you believe they're going to need to see the nurse when she makes her second round of triage, put comments to the effect of that. If when they came in the green zone, they were walking, talking, and seemed okay, but now they're slurring their words, they're not making sense, you look at them and think, did you take something? That could be neurological damage. There could be pressure on their brain. They're going to need to see the nurse. So watch for those subtle changes and use your comments section to indicate the nurse may need to get to that person when she comes to your zone to re-triage. The basic supplies needed to function in the green zone: basic first aid, gloves, bandages, water for rinsing injuries, your paper, pen, a tracking log, and a green flag or some way to indicate this is the green zone. You need basic supplies. Everyone in your zone needs to be checked and accounted for. Consider those who were carried in. If someone wasn't able to walk in on their own volition, they need to be checked out. So watch for people carrying an infant, those doing the horseback rides. Just make sure every single person has been seen. If they can't walk in, then they're not a walking wounded. If they must be carried, they must be checked. You, as a green worker, can do a quick head to toe. Look at the person and quickly say, are they awake? Yes or no? Are they breathing? If they're speaking, they're breathing. Are they bleeding? How much blood? A little bleeding is okay, but if it's starting to form a puddle, that's an issue and the nurse needs to know. How much pain are they in? Were they able to walk in fine and now they're in so much pain, all they do is cry? What's their movement like? And what is their level of consciousness? And by level of consciousness, I mean everything from their personality to can you rouse them if they fall asleep? If somebody came in walking and talking and now yelling and shaking doesn't wake them up, they need to see somebody from the red zone for treatment. Those working in the yellow zone. Yellow zone folks should have a basic first aid kit. Those in the yellow zone will need medical care eventually. So for yellow zone, you'll be doing a lot of splinting, supporting injury, stopping the bleed, putting band-aids, direct pressure. So it would really be in your best interest to go ahead and take some type of first aid and even tourniquet use to work in the yellow zone. And make sure you have plenty of gloves. Make sure you're also using the tracking log, who's in your zone. And if someone leaves, mark it to the transfer to, walked out, left zone, got in private car, left via EMS. Whatever the case may be, how did your victim come to no longer be with you? You want to indicate as much information as you can. Ideally, we don't want to move a victim, but sometimes we may have to. If the scene becomes unsafe, you have to move a victim. If you're trying to stage for EMS departure, we have multiple victims and we're lining them up for ambulance care. We may need to start moving victims to one location. Or if you need to give care but it's not safe for you, you're going to need to move them. Ideally, we don't want to move a person unless we have to. But if you have to, here's some easy steps on moving a person. The first way I'm going to show you is if you're by yourself.
That the first responder can perform. If you find yourself by yourself and the patient needs to be moved from a precarious situation, you need to get them out fast. If they do not have a suspected C-spine injury, this can be done by coming to the patient's head. The patient may be unresponsive and unable to help themselves. So you'll need to lift the patient slightly and place your arms underneath the shoulders into the armpits. From this position, you really need to pull without injuring your back. You want to use your legs. Move your leg back, pull the patient towards you, move your leg back, pull the patient towards you. If you find yourself in a position where you have a second rescuer able to help you, you can now seat the patient into a seated position. The patient may be unresponsive and limp, much more difficult to grab a hold of. So what you need to do is take your right arm, hold on to the patient's left wrist, take your left hand, hold on to the patient's right wrist. Make sure you get a firm grasp. You want to be able to put yourself into a position where you're lifting with your back and not your legs. Rescuer number 2 will also get into position and place their hands below the patient's knees. Once you're ready to lift, you want to make sure that you do it together so you don't get injured. The command will be, ready?
Ready.
Go. From this point, the patient can be moved downstairs, can be put on a stretcher, placed in a chair, or wherever you need them to go.
Each of the first aid kits on the campuses, whether they are the big red rolling mobile aid kits or the 50-man triage bags have a stretcher in them. It folds up. It's a soft stretcher. In the red mobile aid, it's all the way on the left-hand side. In the black or the blue mega bags, it's on the bottom. It unfolds and it has handles on the side. So you do have a stretcher at your disposal, but this is a way in the video that you can move a person without. Another note on this video, the strongest person should take the head side. The weaker person takes the legs. If you're working in the red zone, you should have taken CPR, AED, stop the bleed, and basic first aid. Here are the supplies that you're going to need. It's important that everyone in every zone know where each of these supplies are. If you're working in the red zone and have a small red bag inside the triage bag of your clinic, you probably are charged also with running to get the AED and running to get the big first aid kit. If there are 4 people working in red, all 4 should run for the AED kit and the first aid kit. It's far more important that 4 people go and 3 of them find an empty box than no one goes thinking each of the other went. So these are things you should talk about and why we have a backup to each role. We don't want to be at the zone without the appropriate supplies. Those working in the black zone have one of the hardest jobs. We're so used to trying to save everyone, but in this case, we have to recognize that not everyone can be saved. Somebody still has to write down as much identifying information as possible. If you know who the victim is, you will write their name. If you don't know who they are, write as much identifying information as possible. There should be black trash bags or black tablecloths to cover the victims. We don't want victims lying out in the open. It's important to think about proximity. Where are you going to set up the black zone? It's not a good idea to have the black zone right next to the yellow or the red zone. You want to have it set back a little bit so as not to upset the survivors. It is upsetting. There will be emotional trauma if we ever have to do this, but we can decrease it to the best of our abilities. Additional responders will be assigned by the administrator who's on this team. There needs to be someone who's going to run information back and forth to the principal. Think if we lose phones, what's your mode of communication going to be? Do you have walkie-talkies? Will cell phones work? Or is somebody going to have to run information back and forth? When you call an ambulance, even if it's for one victim, somebody should run outside and watch for the ambulance. This is true even for not a mass casualty, for an everyday occurrence. We have had multiple incidences every year where the ambulance goes to the wrong building. Somebody needs to go flag down that ambulance. Someone needs to do crowd control. There's going to be a lot of hysteria. There's going to be a lot of parents trying to collect their children, children trying to leave. Someone has to be charged with crowd control. These are all roles that your principal can assign. Each administrator is used to working with the Pasadena Independent School District Crisis Handbook. Inside that handbook are plans for almost every type of assault that you can imagine, whether it's weather related or shooting or tornado, it doesn't matter. There's this outline inside, step by step, what every person should do. Your principal is used to working within this context. So whatever your protocol is for other incidents, you'll follow the same type of protocol with a little bit of tweaking. For the most part, you're just going to follow your principal's lead. So what's next? Well, you finished Module 1. Good for you. Some of you need to take Module 2. If your only role is to relay information, then Module 2 is not a must. But if you are red, yellow, green, or black, you need to take basic first aid. Module 3, which is Stop the Bleed, every member who's working in the red zone needs to take the Stop the Bleed course. All nurses in Pasadena ISD have been trained as Stop the Bleed instructors. There's also Stop the Bleed courses on Eduphoria. It's imperative that red members know how to safely apply a tourniquet if it's required. Module 4 is for red. This is CPR and AED. All of these modules can be taken by anybody on the team. They're all open to all employees. Some of them are even open to employee families. But a bare bone minimum, red needs to take all, yellow needs to take modules 2 and perhaps 3, and all of you have already completed module 1. This concludes the training. Get with your nurse, make your plan, start your other modules. Thank you for volunteering to be a member of the Medical Emergency Response Team.